Mr. Tonkin, as I was listening to you, several thoughts came to mind. You were listing a series of activities that are clearly contrary to the normal competitive marketplace, price fixing and the like. There's also an issue in this health insurance sector called vertical integration, in which these large companies not only monopolize the market, but they have now reached into the various other aspects and vertically integrated, owning consulting companies, actuarial companies that provide them with the basic data where they can more easily manipulate that data, now moving into the pharmacy benefit programs and gaining control over the entire marketplace. That is one of the activities that would be able to be attacked by the Attorney General, by the Federal Attorney General, if this law were to go into place. The monopolization of the market, as I described in California, where Blue Cross has 80% of the individual market, leads to a terrible situation. And I'd just like to bring us back to why we are doing all of this, why we are doing the health care reform that is now going to be taken up in the summit on Thursday of this week, why we're doing this particular bill. It's really about Gloria, that 12-year-old girl that I talked about, who was born with a heart condition and also has diabetes. Her father is desperate to hang on to his job and the insurance policy that comes with it, because they know, the mother, the father, and Gloria know that should he lose that job, that family's uninsurable. And that young girl, who has had to fight for every treatment in her 12 years to sustain her life, is an opera singer, a Class A student, and has a future ahead of her. But if they have no health insurance, she's going to die because she needs constant care. I can talk about a retired, well, he did retire because he couldn't continue to work, a carpenter who I saw on his deathbed saying, I just want to live long enough so that my wife can turn 65 and get Medicare. Because if I die before that, she has no insurance and she has a pre-existing condition. There's hurt upon this land. People are suffering for lack of a job, and they know that if they lose that job, they'll lose their health care. And they'll lose their wealth, and they may very well join the 40,000 plus Americans that lose their life for lack of health insurance. This side of the aisle, the Democrats are pushing back against these situations. And tomorrow, one more step, one more pushback, and saying, in America, the present system is wrong, and tomorrow there will be an end to the ability of these insurance companies to monopolize the market, to engage in anti-competitive activities, price setting, vertical integration, and the rest. I want to congratulate, I want to thank Mr. Perriello and Ms. Markey for what you're doing tomorrow in your legislation.